Hello and welcome everybody. I'm Paul McDonald, Chief Campaigns Officer at Health Equals. I'll just give it a second as I can see more people are joining the webinar. That's good. We have a good number have joined now. Great, thank you. So I'm very pleased to be chairing today's Healthier Working Lives webinar on behalf of the Learning and Work Institute. Health Equals are a coalition of organisations who have come together to raise awareness and campaign to reduce health inequalities. The Learning and Work Institute are members of Health Equals, and as such we commissioned the new research we're talking about today, and we're supporting today's webinar. Before I do anything else though, I'd like to introduce and welcome today's panellists, who you can't see, but are here and will be joining in a second. So firstly, Dr. Jess Elmore, Head of Programme, Employment and Better Work at the Learning and Work Institute. Julie Ory, Senior Delivery Manager, Health and Employment at West Midlands Combined Authority. Matthew Cray, Policy Officer, Employment Rights at the TUC. And Chris Bailey, Chief Executive of the Sheffield United Community Foundation and Chair of Sheffield Chamber of Commerce's Health and Wellbeing Consortium. The format today is that each of the panellists will speak in turn and give their insights on the report and the work to create healthier working lives. We'll then have a discussion amongst the panel of questions from the audience. So do please post your questions in the Q&A function. Before I hand over to the panellists though, I'd like to just say a little bit more about Health Equals. So Health Equals is a multi-million pound campaigning initiative to improve health and inequalities. Our campaigns call on the general public, policymakers and sector leaders to recognise the value and benefits of good health for all. From stable jobs, good quality homes that are warm and safe, clean air, neighbourhoods with green space and social connections. At Health Equals, we call these the building blocks of health. Our 27-strong membership and growing number of supporters have come together in recognition that the varied work they do is fundamentally linked to health. And we campaign for everyone to have access to these building blocks of health. Good work is a vital building block of health. Poor quality or insecure work can be worse for people's health than being out of work. And creating healthier working lives needs to be a national priority. Between 2022 and 2023, 35 million working days were lost due to work-related ill health and non-fatal workplace injury. Employers have a key role in promoting healthier work, but many lack the time, resource or expertise to support their workers' health. The new research from the Learning and Work Institute shows that local governments are uniquely placed to engage and support employers. The government's new proposals for skills, health and work plans provide an opportunity for local government to drive agendas for healthier work. So this interactive webinar will explore practical considerations for how local government, employers and wider stakeholders can work together to create healthier working lives in their communities. Thank you very much. Now I'm pleased to introduce our first speaker, Dr. Jess Elmore, Head of Programme, Employment and Better Work at the Learning and Work Institute. And also on the screen there you can see there's a QR code that will be coming up at different times where you can kind of go straight to the reports. Thanks very much and welcome, Jess.
Thank you for the introduction, Paul. So Learning and Work have been delighted to work with Health Equals over the last year on work and health, an issue that seems to have increasing and welcome saliency. Also very happy to be launching our report today. It feels like a very good time to be launching a report with the publication of the new white paper, Get Britain Working imminent. I'm hoping you'll be able to resist the temptation to slip off and read that report at 12:30, but it should be the basis of a really interesting discussion. Could I have the next slide, please, Helen? Thank you. So today we want to share some of the key findings from our report and particularly identifying the role of local government. So in this report, we set out how local governments are uniquely placed to work with employers to improve residents' health. This is because they lead economic growth strategies for the local area. They have deep insight, extensive networks, and the real ability to build consensus across what stakeholders, including employers. They're large employers in their own right, and they have significant tools to use as levers for change. This includes positive procurement, enforcement, awareness raising, and campaigns, and the ability to incentivize local employers. I was going to start naming some examples of what local governments do here, but it felt like it would be a very, very long list. But just to acknowledge all that great work that is already happening. However, the work they are engaged in and the work they have the potential to do is severely limited. This is by funding constraints, a fragmented system, a lack of coordination, and a weak evidence base. In order for local government to fulfil their role and work more effectively with employers, they need more support and better understanding to maximise impact. It is important to identify the wider context of funding challenges, but we're not going to solve that in today's webinar. So what I want to focus on today and what our report focuses on is thinking about how local government can act in a systemic way at a local level to bring about change through the development of local action plans for healthier work and making sure healthier work is embedded across local government action. I think this is very relevant for today's work paper, for today's white paper. We're thinking about the work health and skills plans. As what we do in the next slide, in the next two slides, is set out 8 steps for how local government can develop local action plans to create healthier working lives. So step 1 is around developing a detailed understanding of a local area through conducting a healthy work audit. So this includes an assessment of current and future sectors, occupations and employer types, an assessment of the quality of work, what jobs are available, how good are those jobs, what improvements need to be made, levels of economic inactivity in the local area, any particular health needs of local residents, and a consideration of inequalities and demographics. Having developed this firm understanding of what the local area needs, you can then move towards building an understanding of the current situation, future projections and priorities for change. This needs to be in collaboration with stakeholders. This includes both employers, but also trade unions, and particularly those with lived experience. So we're thinking about work and health plans involving people with disabilities, people with health conditions, and those who are more likely to experience the challenges of insecure work is absolutely vital if we're going to introduce significant change. Step 3 is the importance of implementing a systems-wide approach. So working in isolation or in silos is not going to have the impact needed to create healthier working lives. So a local action plan for healthy work needs to link to wider economic and skills strategies. It's also really important to link actions within the plan together. So, for example, there are tools that can incentivize, that can encourage employers to work to create more inclusive workplaces, such as charters. But if these are linked up with procurement policies, then it's more likely to incentivize employers to comply rather than just offering a bit of stick as well as carrot. Step 4 is around employer engagement. So we need to segment by employer type, particularly thinking about SMEs and micro employers and the particular needs of those employer groups who don't have an HR service, who don't have an occupational health service, and how they can be supported by a local authority. Also need to segment by sector, so thinking about sectors such as hospitality and transport, where healthy work may look very different to a desk-based job such as the one I'm doing. Also important for local government to act as an exemplar employer and encourage other organisations to do the same. On the next slide, I set out the next 4 points for our local action plans. So it is very important to address issues of equity and inclusion, protected characteristics, and consider regional inequality and any particular sectoral challenges. So this needs to consider sectors where there are particular risks for healthy work, or occupations where there are particular risks, and any populations that might be in particular need. It's also important to think about self-employed people. So quite often self-employed people can be left behind when we're thinking about how to create healthier working lives. So building them into a plan for action is really important. Step 6 is to think about how campaigns for healthier working lives can be linked with other health campaigns. So local governments already do a range of campaigns on stopping smoking, increasing healthy eating, encouraging vaccination, and making sure that healthy working becomes a campaign the same way. And linking together that into an overall health strategy could be very effective. Step 7 is embedding the dimensions of job quality in relation to healthy work across all aspects of the action plan. I'll go into this in a little bit more detail in the next slide. And then the final step is about measuring success. So this is the need to adopt a test and learn approach. So we need to collect systematic evidence and commission and publish robust evaluations. There's lots of evidence that local governments are already doing a lot. The problem is we don't necessarily know if they're doing what works, and we're not evaluating that effectively. Could I move to the next slide, please? So as I mentioned, it's really important to have consistent principles when looking at healthy work. We can do this through looking at the dimensions of job quality. These dimensions come from the Carnegie UK Trust and the RSA Working Group on measuring job quality. They were developed in a UK context, and they're very relevant for us. There is a complex relationship between work and health, but we do know there are links between job quality and health. So, for example, we know insecure work can be a threat to health, while flexible work seems to bring benefits, as does a good work-life balance and good relationships with line managers and colleagues. However, we need to know more about the relationship between healthy work and job quality, and we need to know more about what we can do with employers, with local authorities to move the dial so that everyone has access to healthier work. I would suggest the main message from our paper is that if we can use these principles consistently, apply them across different local authorities, we can help to build the evidence of what works to give us all healthier working lives. I'm really looking forward to our discussion, but for now I will hand back to Paul. Thank you.
Thank you very much, Jess. Thank you very much. Here is the QR code again for everyone. I saw there was a question in the chat about that. So there it is. You can download the report. Great. And I'm pleased now to introduce our second speaker, Julie Orey, who's Senior Delivery Manager, Health and Employment at West Midlands Combined Authority. Thanks very much, Julie.
Thanks, Paul, for the introduction. So I'm delighted to be part of this campaign and have been consulted on the paper. And thank you for the opportunity to talk to you all today about how the West Midlands Combined Authority has engaged with employers to promote healthier workplaces. So as we've already heard, national sickness levels are rising. In the West Midlands alone, over 3.1 million working days were lost last year due to work-related ill health. But we want to imagine a region where fewer people are calling in sick because they're able to thrive at work, both mentally and physically. And here we've recognised that healthy workplaces are not just about productivity, they're about people's well-being. So promoting health and well-being as part of good work is at the heart of our strategy, and it's a cornerstone for inclusive growth in our region too. So I'm going to talk to you today about 3 specific examples which demonstrate sort of the Combined Authority's leadership in piloting and scaling innovative programmes and activities that support health and employment integration. So the first of those is Thrive at Work. So Thrive at Work is our employer wellbeing commitment. There are lots of employers, small employers, who don't have resources of large corporations, and the programme has given them access to tools and support and training that prioritise mental health and well-being. So it's a free offer to any employer within our footprint, and we've got over 600 employers now signed up. And this year so far, our very small, very dedicated team has delivered 948 employer support meetings, over 45 workshop sessions and 20 themed webinars. And we've got cross-sector uptake, which also includes the public sector, so local authorities and NHS organisations. So just a very brief overview, some of the positive outcomes include better policies and practice in health and wellbeing in the workplace and improved manager and employee communication. So, for example, a local bakery that has 15 employees reported a 20% decrease in absenteeism after integrating some wellness initiatives. A local printing company only had 6 staff improve their workplace culture by introducing flexible work policies, and that increased job satisfaction and retention amongst employees. And a local charity that only has got 12 employees was very pleased to be offered our healthy lifestyle app to use for free, as they don't have any occupational health offer. And it's really made a difference to them and their engagement with their health and a healthy workplace. We're also linking in with other initiatives across the region. So Thrive at Work is supporting the Workwell vanguards around any employers with the in-work element. We're lucky to have 3 in our region, and actually working with any employers to support anyone in work at risk with improving the workplace by working with the employers to increase capacity beyond the Workwell actual delivery model. We're linked into the new NHS Workplace Health Check pilots, and we're also working with ICBs on and public health teams on promotion of health messages through those employer networks. Another programme which we've been involved in from the outset is Thrive Into Work. You'll see a pattern here with the Thrives. And that's our employment support programme, which uses the IPS model. So it's individual placement and support. And that integrates health and employment support. And it puts an emphasis on the importance of finding the right job for anyone who's got a health condition or a disability. And the coaches work one-to-one with individuals for up to 9 months to get them into work, or if they don't get into work, they're much nearer to the labour market. So an example of this was a lady called Sarah, who was a single mum. She was recovering from a mental health condition. She wanted to get back to work, and coach worked with her to help her find a job that not just matched her skills, but also offered a supportive environment for her to go back into the workplace into. And they also gave her employer training on how to adapt workplace practices to meet Sarah's needs. And this successful model, which is sort of running in other parts of the country as well, it's already supported hundreds of people in our region, and also the employers of the workplaces that they're going into. And that model will be used in the upcoming Connect to Work programme, which you'll probably hear a lot more about in the white paper that Jess has already mentioned. And then finally, something that's slightly different is our inclusive growth team have developed an inclusive growth decision-making tool. And this tool provides a structured framework for employers and investors to ensure policies align with the principles of good work. And so it looks at things like job security, pay equity, workforce development, and ensuring investments contribute to healthier and fairer work environments. And so embedding that tool into decision making helps ensure that any growth it fosters is inclusive and benefits all sectors of the workforce. An example where that's been used was in a regeneration project in Birmingham, and they used the tool to create secure, fairly paid and inclusive jobs. So what have we learned from this? So one of the key lessons is to provide tailored support. So for Thrive at Work, we recognise that 90% of the businesses in our region are very small, with fewer than 10 employees. So we adapted and tailored the support specifically for them to provide accessible resources, but also a dedicated CIPD qualified member of staff who helps them implement that change. Gives about 50 hours of access to expert advice and support that they wouldn't have, and therefore maybe wouldn't be able to adapt to change policies and make that change. To use innovative models. So Thrive Into Work shows the potential of integrated health and employment services to address systemic barriers. We also adopt a health in all policies approach. And also I've mentioned the inclusive growth decision-making tool. That's prime examples of our commitment to embedding good work in regional growth, and reinforces our holistic approach to integrating health work and economic development. And building strong partnerships and convening and local leadership. So engaging anchor institutions regionally and locally to improve job quality and increase opportunities for local people, particularly around non-traditional routes and leveraging procurement for social value. And we've also been linking international work like the Prevention of Ill Health in the Workplace initiative with HSE, Healthier Lives Working Commission, etc. And just to back up what Jess said about embedding evaluation and learning. So we always try to ensure any work programmes have ongoing evaluation to adapt those strategies effectively and show the potential for scaling any successful models. So in conclusion, my key calls to action on this is obviously to capitalise on the government's new proposals for integrating health and work plans and skills, obviously, through consistent and measurable local action, enhancing local leadership, so empowering key partners, whether that's through devolution or just through partnership working, make sure that there's sufficient funding and expertise and support to develop and implement healthy work agendas, but also bridging any identified gaps and ensuring things align with both policy ambition and the actual practical changes of making change and getting work done, particularly in light of the current climate for local authorities. And finally, to encourage and incentivise employer action. So developing stronger mechanisms, and I'm sure some of this will come out in the Employment Rights Bill, but linking things like charters to procurement, motivate employer participation in healthier work practices, but also give them support to deliver on this and drive behaviour change by scaling proven initiatives like our Thrive at Work initiative that we know work. Thank you very much.
Thanks very much, Julie. Thank you very much. I'm pleased to introduce now Matthew Cray, who's Policy Officer on Employment Rights at the TUC. Thank you, Matthew.
Hi, everyone. Can you hear me okay? Yeah. Thanks very much for publishing this really important report. I think there are some key findings which flag the scale of work-related ill health, the causes of the problem, and some recommendations for moving forward. One thing that struck me is the Health and Safety Executive estimated that the cost of work-related ill health costs the UK sort of £13.1 billion. So it's absolutely vital for worker health, productivity, and the economy that this issue is addressed. I think as a trade unionist, the key finding that jumped out to me from the report was that greater focus needs to be on the prevention of work causing ill health and promoting good health through work. So we'd sort of strongly support the notion that decent quality work leads to the greater health of workers. What we've been doing recently at the TUC is really focusing on the Employment Rights Bill and trying to make sure that the legislation that's coming through the pipeline will lead to more decent work. But I think this report was a really good reminder that legislation isn't the only way to achieve the change that we're looking for. And it was a good reminder that local government has a key role to play in sort of convening key stakeholders together to take action in a more local, targeted way. So I was just going to put forward a few ideas around how trade unions, employers, and local government could come together to improve working lives and in turn make people more healthy. So I was going to look at suggestions around sharing best practice on the Make Work Pay and Employment Rights Bill reforms, decent work employment charters and how they might be able to drive up standards of work, identifying and tackling labour market exploitation by working with other government agencies, developing a procurement strategy and perhaps having a procurement task force with the involvement of trade unions, and finally also having a skills and apprenticeship task force with the involvement of trade unions and employers. So firstly, just looking at how local government could convene forums to share best practice on the Make Work Pay reforms. What I mean by that is I think some of the employment law reforms are going to be voluntary and not set out in legislation. So, for example, the right to disconnect or switch off, the guidance around that is going to be set out in a code of practice, and employers and unions will be left to negotiate what policies will work for their workplace. And the right to switch off is a key tool for tackling work-related health issues. It makes sure that people get a proper break from work. It tackles work intensification, enables workers to spend time with their families and stay healthy. So I think there could be a key role for local government there to look at what's happening in the local area, share best practice around these policy, find out what's working and what isn't. For example, the media's reported a lot that a right to switch off or disconnect might be a ban on emails outside of working hours. But unions have negotiated policies with employers where there's a lot more innovative ways of allowing workers a proper right to disconnect. So I think the local government organisations could play a key role there in sort of sharing and disseminating best practice between employers and unions to make sure that that policy is effective as possible. Decent work employment charters. So TUC and unions and employers have worked with local government to create decent work charters already. So these look to set out what standards of good work should look like in local areas or sectors above the legal requirements. So they might have stipulations around job security, worker voice, skills training and pay. And I think the idea could be that the local government could promote these charters, encourage employers to sign up and commit to improving working conditions, and then maybe using these charters in the procurement process. I think there has been a worry that charters don't lead to real change, but I think if local government played a key role in bringing stakeholders together, they could encourage more sign-ups to charters, monitor compliance, and also use discussions to try and figure out what changes could be made to sort of meet the basic requirements of the charters. The third area I was going to talk about is identifying and tackling labour market exploitation, and I think this is touched on in the report. I think there could be a key role for local government to bring together the main employment rights enforcement bodies alongside employers and unions. They could identify where labour market exploitation is happening in a local area. Employers and union reps would be uniquely placed to know what trends are emerging, where bad practice is happening. And I think that approach would help stamp out poor quality employment that is a contributor to ill health. And the employment rights enforcement bodies are often saying that they need greater intelligence and greater evidence submitted to them. So I think that's a key role that could be played there. And maybe there would also be an opportunity there to say that where workers lose their jobs because an employer's been closed down because it's been found to be non-compliant, there might be routes there to find those workers alternative employment and make sure they're not sort of stuck without a job after the employer's been punished. The fourth area I was going to touch on is developing a procurement strategy. So perhaps local government could set up task force involving employers and trade unions to try and use procurement to drive up employment standards and improve worker health. So what sort of things might a procurement task force look at? Well, they could look at what role do employment standards currently play in the procurement process? What role should they play? So, for example, unions have been pressing the case that procurement should be used to sort of only award contracts where employers can prove they've got really high quality working standards. The procurement task force could look at how contractors get assessed to ensure they're meeting those standards. They could monitor compliance and also try and drive up standards as well by working with contractors. And then finally, perhaps a task force around skills and apprenticeships could be useful as well. So the local government could bring together employers and unions. So unions, for example, have union learning reps in a lot of workplaces where union learning reps could have discussions with employers to encourage them to take up apprentices. ULRs often negotiate good quality apprenticeship frameworks and provide support to apprentices in the workplace. So I think that's another area where stakeholders could work together to improve good quality opportunities for young people. Thank you.
Thanks very much, Matthew. Thank you. So we're having a little bit of a technical issue with our final panelist, Chris, joining. But while we're just trying to sort that out, just a kind of plea to all the audience there, do please post any questions you have. You see the Q&A function at the bottom of the screen there. So if you do have any questions for the panel, do please post them there. And I think what we'll do while we're waiting to see if our final panelists can join is maybe I'll just move to start some questions. And if Chris comes, then we'll go to him speaking. So without putting you on the spot too much, could I just, as Jess, as you were the first speaker, can I just ask you a couple of questions first? Is that okay?
Yes,
Great. Thanks very
absolutely.
much. So it was very interesting, everything you were saying, and around the local action plan. So I just had a kind of broad question around the local action plans in terms of what are the challenges for developing those local action plans, and what can maybe be done to overcome them. And probably key to that is, how do we incentivize local governments to develop those plans and have them in place?
Shall I answer the question and then we go to Chris? Is that
Yeah, that's what I
best?
was
Yeah,
thinking. Yeah,
yeah.
thank you. Yeah.
I think to start with your last point, I'm not sure we need to incentivize local governments to take. I think local governments are very keen to step into this role. I think there's a real challenge for them in terms of funding constraints that is limiting them taking part, but I think it's something local governments are keen to do. In terms of the challenges, I think as you would expect from a research and development organisation, I think there's a real challenge around evidence. So we can see that there's an enormous amount of goodwill in this area. So people want to see change. There are different charters, there are different strategies, there are different accreditation schemes, but we don't actually know what is working. And until we can understand what is working, put measures into place to collect that evidence, we're not sure if what we're doing and all that time we're spending is actually right. So my plea would be for better evaluation.
Thank you. That's good. Thank you very much. Okay, I'm going to introduce our final panelist now, Chris Bailey. Very pleased to see you, Chris. Sorry if we had technical issues before. So the final panelist is Chris Bailey, who is Chief Executive of the Sheffield United Community Foundation and also Chair of the Sheffield Chamber of Commerce's Health and Wellbeing Consortium. Thanks very much, Chris.
Thank you, Paul. Apologies for the technical issues at my end. It was just interesting listening to the last comment there, actually, around evidence-based practice and research behind that, because I think that's what I'd like to talk to you about today in terms of what we found in Sheffield through the Chamber of Commerce and our members is they didn't really know where to start from an employee health and wellbeing perspective. So one of the things that we have done in terms of what we are calling the Health and Wellbeing Consortium is exactly that, is to try and understand where we are as a city right now. And I appreciate there is a lot of onus on central government, local government around putting policies, legislation and in place and supporting workplace wellbeing. But as a community organisation, we tend to do a lot of work around sort of a bottom-up approach and put a little bit of that ownership back onto individuals and individual organisations. So here in Sheffield, we have a physical activity and wellbeing strategy called Move More, and I chair a communities subgroup around Move More and what it means to be healthy, what it means to be physically active from a community's point of view. One of the things that we found was that a large part of the community in any town or city or organisation is the workplace. It's the people of working age population. And within that strategy, there wasn't actually a space for workplace wellbeing, which led me to a conversation with Louisa, the CEO of the Chamber of Commerce, around how we can work within that space and work with our organisations and set up a consortium to find out what's currently happening in Sheffield, and therefore then identify the gaps in Sheffield and how we can improve on that. So after a couple of initial meetings with what is now the Health and Wellbeing Consortium, so we worked with Westfield Health to undertake a survey across the members of the Chamber of Commerce to identify their confidence levels in health and wellbeing, their understanding of health and wellbeing from an employee perspective and an employer perspective. What are their rights, their responsibilities? Where do they start and stop in terms of looking after your employees' wellbeing? And out of that, we developed a pilot which we are hoping to become a school of excellence and have some sort of citywide kite mark attached to that, with the objective of working together to share tools, data, and communication with employees to understand the benefits of supporting their employees, but also using that data to map the challenges and barriers to engagement in health and wellbeing so we can work together to overcome them. And when we map and monitor which services are being accessed, which services maybe aren't being accessed, we can highlight gaps in provision across the city, and work together to generate and share a baseline of that current data, which we can then measure improvement and review in a year's time. We have recently launched the pilot. We've got 15 pilot organisations in that. And initially it came out of some of the statistics that were discussed earlier around trying to reduce physical health absences, which are approximately 58%, so 6 in 10 people taking time off for physical health issues, but also mental health absences, which is approximately 38% of work-based absences. But then beyond that, we looked at holistic health and wellbeing and incorporated social wellbeing, because we know that workplaces can be very sociable environments, and we spend a lot of time in our workplaces over the years. But also we added financial wellbeing in around, because we know that can be a stressor for employers and employees. So there's a two-pronged approach to that. The consortium came together and they've completed sort of baseline data. And what we've actually found is there's some really, really positive initiatives happening across the city, but it just needed somebody to pull that together. And we feel as a chamber, we have the resource and the commitment to do that and pull that data together so we can further support our communities. And fundamentally through that, we can hopefully align some of the central and local policies, legislation, guidance into the work that's already happening. So we're not actually building from a blank sheet of paper. We know we've got a strong foundation of what's happening in the city, and we hope to then use that to connect businesses, connect through communities, amplify what's happening in the health and wellbeing space, to learn from each other and share that learning, and then use the position of the chamber to influence positive health and wellbeing in the workplace. That is all I have been briefed on speaking. Apologies you had me today and not my counterpart from the chamber, but I'm really open to any questions with the panel as well. So thank you for your time.
Thanks very much, Chris. Thank you very much. So we're going to move to Q&As now. So questions for the panel. So do please post them. We've got some coming in there in the Q&A function. So you'll see it at the bottom of your screen. Do put any questions you have in there. So maybe if all the panelists would like to put their cameras on now, that'd be great. So the first question I can see there in the chat is from Alex at the People's Health Trust, fellow members of Health Equals. And the question is what role can or should the voluntary sector play in working with local government to develop local action plans? And then there's a specific question about how has this worked in the West Midlands for Julie. So I don't know who would like to go first with that.
I'm happy to drop in, Paul.
Thanks.
Just from a sort of local perspective, that I would say that through the anchor networks, there's been a lot of engagement with voluntary community and faith sector organisations to input into these sort of big thematic questions around employment, employability, social value, those kinds of sort of bigger picture items, and then actually looking at how we utilise the networks we've already got and capacity build, use this sort of, community asset type approach to actually build on what's happening. So, and also from a health perspective, so I can give you a really good example from the Workwell pilot in Birmingham Solihull. They have recognised that actually outreaching to people who are inactive and but want a job would have more impact by working with community organisations, and so they've actually contracted for community-based delivery partners to directly do outreach and referral, because they recognise that that would have way more impact than trying to just do a marketing approach by themselves. Certainly our local authorities are working very closely with all the VCSE, and again back to not picking up Birmingham Solihull, but it's just a good example. Recently held a social value conference inviting all their partners and the ICB and both of the local authorities within that sort of health economy have all made a massive commitment to doing more social value procurement, with an aim of getting up to sort of 40 to 50% of any contract being from a social value perspective, sort of long term, that it's just kicked off. But really, you know, inviting partners to come to that conference, talk about what they've got to offer, but also have a voice and have a platform for saying, this is how you need to contract with us and this is how we need you to support what we do. Don't reinvent the wheel. We're already doing it. We can do it best. Just make sure that, you know, we do it effectively and do it together. So I think there's a real move towards that, and we've been looking at that internally within the West Midlands Combined Authority as well, in terms of how, you know, we contract and how what impacts of social value and how we work with community partners, and how also we, you know, we're able to pump prime and innovate activity that then can be utilised locally. So I feel, coming from a sort of VCSE background in the past myself, it feels much more on the table and more engaged than it's ever been. So, you know, hopefully we're moving in the right direction.
Thank you, Julie. Thank you. Matthew, I can see you've got your hand up. Thank you.
Yeah, I was just going to respond to Alex's question. I think that the voluntary sector should definitely play a vital role in helping to develop the action plans. So our experience of working with community groups is that they can be a real vital support network for some of the most precarious workers, and they often have an excellent understanding and sort of first-hand experience of the real issues that workers are facing. So we've seen that with some of the most exploited migrant workers who unfortunately don't join trade unions as much, and trade unions find it hard to engage with them. So, for example, overseas domestic workers who work in households where they get exploited, seasonal workers who are picking fruit and vegetables in fields, some care workers. So the community groups there, they're trusted, and would play a key role in sort of developing those local action plans. And just to flag an example, I think in Leicester, in the exploitative textile sector, they had community groups, unions, employers, local government, and the enforcement bodies come together to sort of launch an investigation, find out what was happening in that sector. And following that, the community groups set up a centre and had community organisers who could go into the workplaces to speak with workers and refer them on to trade unions if they needed to. So yeah, I think it'd be great for them to be fully involved, and hopefully when those local action plans, we find out a bit more about those, perhaps they could set out a framework to show which relevant sort of to try and involve all the relevant stakeholders and make sure all the correct people are sort of sat around the table.
Yeah, absolutely. Thank you, Matthew. Chris.
Thank you, Paul. I suppose I'm echoing something that Matthew said briefly there about building trust. So to answer Alex's question around the voluntary sector being involved in this area, it is fundamentally about trust. I'm a firm believer that people aren't hard to reach, services are hard to access, and what you've got in voluntary sector organisations is there is already a trust there. There are a lot of partnerships and relationships that are already built at a local level, and actually this piece of work is very much about collaboration and working with the right partners so that we can make the services more accessible. So I just want to echo that point, what Matthew made around trust.
Yeah, thank you, Chris. Thank you. And Jess.
Yeah, absolutely agree with other panelists, but I think it's important to recognise the voluntary sector is a very wide sector. It includes lots of organisations. I think there's a particular role we're thinking about healthy work for disability rights organisations and disability-led organisations, for them to be involved at every stage of a local action plan through identifying needs and through co-designing intervention. So that's a very clear, specific part of the voluntary sector that I think is crucial to get involved.
Thanks, Jess. Move on to another question then in the function. Difficult question, but person says, I find effective employer engagement to be a real challenge. Any tips from the panel? Anyone's got any tips there? No. I've got on, Julie. Yeah, thanks.
Just really to say with our Thrive at Work, I think I mentioned in my talk about how it offers them something they wouldn't normally have access to. So whilst they might want to make changes, it's almost like you have to support them to be able to do it. And we're fortunate in that obviously we've got funding for that programme that we can offer that service out for free and they get that support. But what it does do is it gets a commitment from them to actually do that work alongside somebody. I think some of our conversations we've had with local authorities around their employer engagement are saying there's so many offers out there now and asks of employers. We need to think about how we streamline what we're doing and work collectively together to look at where there's no duplication, how offers can actually sort of work, mesh together in terms of a broad portfolio of offers around specific activities and who to go to for what, and make the most of our resource, but also not be bombarding them with a whole raft of things, because obviously there are commercial partners out there as well that are harassing people. We're getting it at the moment with information coming in around, we can provide your Connect to Work program and just bombarded. So I know how they feel about it. So I think it's important to recognise that they're being hit from all angles and actually try and look at where you've got good relationships with other people that can maybe co-communicate or work symbiotically with people to do that.
Yeah, that's definitely very true, Julie. Thank you. Chris?
Yeah, I feel like I've not got too much to add to that, Julie. I think you hit every point really, but fundamentally, from our perspective, it's about asking them what their needs are, what their challenges are, as opposed to taking solutions to them. We found that a lot of employers in Sheffield, through the research with this particular consortium, they don't know what they don't know. So we've sort of had to take them on a journey to find out what the needs are, as opposed to coming up with a plethora of potential solutions, so that it then organically streamlines to the solutions. So it's almost like it's a process, like a machine. It comes in at this end, and then we do all the consultation work, and then it comes out of the other end where we have streamlined a couple of options that could then hopefully provide a solution for them, as opposed to the bombardment that Julie mentioned.
Thanks, Chris. And there's a specific question here for you, Chris, so I'll just move straight on to that now. So, Chris, how did you ensure that you, the Chamber, and other business organisations were collaborators rather than competitors in the space?
Through lots of conversations and cups of coffee, I think, is the short answer. But Sheffield is quite a collaborative place to start with. I think bringing the football club brand in it from a community foundation point of view, we work with a lot of the partners that are around the table anyway. So I feel like me stepping into that space, we could be the glue and bring the people together. But ultimately, it was you've got to answer the question, what's in it for me, when you're talking to all the partners around the table, because they are businesses. They have to have a turnover, turn a profit, make an impact, whatever sector you're from. So again, it was asking, what do they want out of it? What are their needs? What are their expectations? And really having open and honest conversations around why we're all involved in that space. And that did lead to some organisations stepping out of that space. Don't get me wrong, it's not for everybody. But the people around the table and in the room now, in terms of driving that forward, we have a very clear vision and mission for this proposed School of Excellence around health and wellbeing, driven through the Chamber. But don't be afraid to have open and honest conversations. Don't be afraid to have difficult conversations, because ultimately you will find that organisations, if they're not in, they're in the way. So we do have to try and, it's a delicate balance, but just be open and honest and be prepared to have some conversations.
Yeah, absolutely. Thank you. Thank you to the participants, the audience, for all the questions that are coming in so far. So do keep them coming, please. Here's a question now for the panel. So true that lots of employers are doing good work, but what are the benefits of doing it together? What's the added value? If anyone's got any thoughts on that. Oh, I think, Julie, you were first to the draw there. Thank you.
That's okay. I don't mind going second. I think I already alluded to that in saying, you know, that there's the benefits of a streamlined approach for not bombarding people to do activity, but I think there's an element of potentially peer support of if you're looking at, you know, similar organisations and how they can support each other, also looking at supply chains as well. So if you've got a big employer and they're doing lots of really good work around health and well-being, it's how they can then support their sort of smaller organisations in their supply chain and cascade that down and create that sort of model. So you know, I know of one sort of really big employer in our region that's doing that, and in fact they're part of the workplace health checks pilot, and they've had to take it off their site to a community venue because security in terms of people accessing the site. But what they're now saying is, now we've got a bigger building, actually we can open it up to more than just our employees. So we're looking at how they're going to then create access for potentially, you know, smaller employers and their employees, or even members of the community. So it's that kind of thinking that I think has a benefit of that, you know, kind of caring and sharing, we're all in it together. If employers have got that mindset, that sort of, it's like ripples in a pond. So I think that approach is quite helpful, and it's also part of their corporate social responsibility as well, to be able to actually utilize the big resources they've already got and share that sort of sharing health and wealth, I guess, together.
Thanks, Julie. Chris.
Yeah, very well put again, Julie. Thank you. Similar sort of points in terms of the words that come to mind for me are efficiency and effectiveness. You can be more efficient with the resources that you have, and therefore be more effective with the resource. And it enables to build capacity and to empower other smaller organisations, sole traders, etc., because there'd already be a framework in place that actually is streamlined already. And again, you can pull on that collaborative resource with larger organisations and fundamentally get to a place where the impact is more profound as a result of the efficiency and effectiveness. So I'm always a big fan of collaboration over competition. The bottom line is the impact that you can have in doing that.
Thanks, Chris. Question now, maybe for Matthew, around how can employers be supported and invest and incentivized to invest in the healthy working agenda?
Oh, sorry, I'm struggling to get off mute there.
Thank you.
I'm not sure I've got a great deal to add to that question, but I suppose when we get the more details about the local action plans, it's about making sure that it's not heaping a load of extra burdens onto business without any additional funding or resources. So I think making sure that there's a plan for some proper funding within that plan, which we'll hopefully have a look at soon as well. But also I think local government and employers can access support through working with trade unions as well. So in my presentation, I was sort of mentioning the role that union learning reps and union reps can play in the workplace. Well, they can play a vital role in finding out information about what's happening at work in terms of issues and what's happening in supply chains, carrying out skills audits of workers, communicating that to management, saving them time, sort of having to go and speak to individuals. You can do collective consultations and discussions that way. So I think there are different avenues where employers can access support to develop the local action plans. I think you're on mute, Paul.
Very sorry, it was about to happen at some point, wasn't it? I was just going to say, I'm just going to put you on the spot one more final time, Matthew. There's a question for you around what's the best level at which to engage with the TUC, or any specific contacts for people there?
Well, considering I'm here today, I'm very happy to sort of speak to people and direct people onto relevant colleagues. So happy for you to share my contact details with people. But unions operate different structures. So, for example, the TUC's got, I think, 6 or 7 different regions where we have staff working in the regions who have responsibility for working with local employers and local government. So I would probably direct you onto them. And then we have affiliated unions as well, for example, who work in specific sectors. So if it's an employer from a manufacturing sector, I'd probably pass you on to the regional officer from that relevant union. But yeah, happy to help people be sort of signposted to the correct people.
That's great. Thanks very much. I'm just mindful of time here. So just one final question remaining here, I think, before we wrap this up. It's probably for Julie, I think. It just says, is there relatively widespread awareness of uptake of IPS approaches, examples like Thrive to Work, across local governments?
So the IPS-PC model, there's also a mental health strand as well, is funded through DWP and I think DHSC. It's a sort of joint initiative. I couldn't tell you because it's not exactly my program, but I know that I think there's about sort of 6 different work stream projects across the country at the moment. But the idea is that model and also the SEQF, which is around people with sort of learning disability and other barriers to work, will be utilised in the new upcoming Connect to Work programme, which is replacing what was touted as universal support. The guidance for that, as far as I'm aware, hasn't fully been published yet, but there has been a reach out to local authorities and health partners to start looking at developing a delivery plan for that model, so it will be much more inclusive. And that does have an in-work element again as well for supporting people who are at risk of dropping out of work with employment support. And the kind of accountable bodies who that will be filtered through are mostly sort of mayoral regions offices, but also I think there are other cluster groups of local authorities where there aren't mayoral regions, but the best people to get that information from, if people are interested, if you don't have a mayoral region or you're not sure who that would be, is maybe to any Department for Work and Pensions contacts. And then once the guidance is published, which is sort of imminent, it will say in there, I imagine, who the accountable bodies are for each area, so people know who to contact. But it will be following the IPS model, because it's a sort of fidelity model, and it works. So going back to what Jess was saying about things that are well evidenced and work, that's why they're going down that route. And so that will sort of morph from the current programme into Connect to Work, which has got much broader eligibility criteria as well, so it will help a lot more people.
Thanks very much, Julie. Thanks very much. We're just about out of time, so it just remains for me to just say thank you very much to the panelists, to Julie, Jess, Matthew and Chris. Thank you to the audience, everyone here who's taken the time to come out and listen to this. And do read the report if you haven't already. I have to say I really enjoyed reading it. So I think we're out of time here, but here's the QR code one final time. So do please take the time to check out the report and read that and get involved. So thank you very much, everybody. Thank you.